In the early 2000s, the average adult onset age for osteoarthritis was 67. Over the past 20 years, that's dropped to 52. So we're not seeing this as an old person's disease anymore. These people who are in chronic pain, it just keeps getting younger and younger. We treat osteoarthritis very well. So we reduce inflammation in the joint. We see a lot of people with bad knees, and bad knees is the kicking off point for a downward spiral where when you can't or don't move, the joints just get worse and worse. And it's extremely highly correlated to depression, increased chronic anxiety. You see people just ascribing this to age. Like, I'm just old. Part of our job is to educate and say, you can get out of this. You know, it takes consistency. The longer you've had it and the more damaging that trauma has been to the tissue in the first place, the longer treatment like this takes to help you.
People can go like 10, 15, 20 years plus with back pain. It's like, oh, it's just what it is. There's almost like this psychological excuse that because people are so overwhelmed and busy, unless pain is like really screaming at you or debilitating you so that you can't do normal activities, sometimes the motivation to actually change what's hurting cannot be there. And this is where I think the photobiomodulation conversation for me is absolutely fascinating, because think about what we would do back in the day, like go back to like 1850, right? If we were living in harmony with nature and we had an injury, we would address it through being in sunlight, through using different mobility and massage, or we would rest.